guys, it's Paula Nutting, your musculoskeletal specialist. And I was thinking about just general ways that I can give you a little bit of help with some aches and pains. And as you know, I try to specialize in musculoskeletal, hence the name. And we also look at what's going on with the connective tissue as well. So things about joints, things about the fascia, things about the nervous system, and ways to actually make you feel like you are feeling stable and going to have an awesome day. So I'm going to come up to the neck today because I actually played golf yesterday. It was a great, fabulous day, but we do a lot of rotation. So you're there and you actually do a little lateral flexion when you're coming through. Your chest is forward and you're coming through with this drive. And this morning I woke up feeling that my neck was a little bit uncomfortable, and I could actually feel that scaling, like it's just a really ropey, bandy scaling. And I thought, what am I going to do about it for self-help? Because it's really hard to actually get self-help. It's really hard to get other people to give you a hand when you wake up in the morning and go, oh gosh, what's going on with my neck? What's going on with the shoulder? So what do you do for yourself when you actually have problems that you wake up with and you can't come and see somebody like me? So first of all, we're going to palpate. So we're going to feel down, and you can offer this to your clients as well and your patients, but feel along this suboccipital ridge. So we're actually feeling along from the mastoid process all the way along both sides to see if they feel even, because sometimes the area that's painful is actually not the area of complaint. And you want to make sure that everything feels normal along there. So right up into the skull, up into the occiput, and I'm just gently going to tuck my chin down. So I'm accessing the top 3 cervical vertebrae as much as I can, and I'm coming along the lateral joints. And when you're working like this, it's just 2 fingers, and I'm just doing a little cross fiber work. Even though I'm assessing, I'm actually still getting a little bit of a treatment as well. So you can see my shoulders are actually trying to be nice and relaxed and drop down. I'm not hunching up like this because it's not cool. And you're actually activating muscles that you don't want to be working on. You don't want to be activating your upper trapezius while you're palpating along the lateral border of where the levator scap comes in, and also where some of the splenius muscles, so you've got your splenius capitis and your splenius cervicis, and then your scalenes. So I've actually found a tight ridge, which I'm guessing is probably posterior scalene. And I know that kind of is coming down to first and second rib. So before I come up here and cross fiber here, I'm actually going to palpate and see if I can feel into that area where the ribs are. And if I'm going to come along here, I'm going to find the upper trapezius. So we're looking for the upper trapezius right here. And I'm going to duck in anteriorly to it and just pinpoint. So I'm pressing my fingers down into that space. And sure enough, it's actually quite tight and painful. And I'm going to feel the other side to see if it's the same or different. And it's completely different. So here's the trick, guys. I'm going to drop my ear down to give a little bit of softness in the tissues. Really come down. So I'm pressing down. I'm depressing onto that space that feels like it would be accessing first rib to help access the second rib. And I'm going to laterally flex away from the area. So I'm giving myself a little bit of a stretch, an active stretch, dropping in, relaxing, coming a little bit deeper. So I'm actually holding this elbow to give me a little bit of pressure in to assist in that move. So down I go, press down into it and glide away. And one more time, I'm just going to come a little bit more medially. So I'm going to come closer to the neck. I'm dropping down and in, and that actually feels fantastic. I'm going to pull away, and I'm actually pulling away and taking the chin away and down. So I'm actually trying to access those fibers for posterior scalene, dropping down and back, and then coming along and forward. So lateral flexion with a bit of flexion as well. And then I'm going to palpate and see, has that made a difference? And yeah, it actually has made a difference. That scalene's feeling a lot less taut and bandy. And I'm actually feeling a little bit better through range. So what I want you to do is I want you to think about the things that make a difference to the neck. Don't just be always playing up here. Sometimes we have to look at our attachments. And in this case, we're coming down to play with first and second ribs. We could also come in at the front of the chest and palpate along and see what we can feel where the subclavius is, where some of the pec minor, pec major fibers are, and palpate on the actual ribs. Do they feel stiff compared to the other? Probably about balanced. So I'm not overly concerned, but I am going to be doing some stretches for my pecs. I'm going to open up through the pectoralis major and pec minor. So internally externally rotating and getting a really good stretch, probably finding a wall or somewhere to do that, and really opening up the whole of the anterior space to make my neck feel better. Anyway, I hope that's going to help you guys. Have a fabulous day. Make sure if you've got a cranky neck that you can loosen it off, and that's a great way to do it.